So I think we've had a relationship with the Ministry of Health for the last 10 years. It started off with us having discussions regarding areas that we can give some support to Maldives, in Maldives itself, not just taking patients to India for treatment. So initially, the Ministry of Health told us that they had certain particular areas where they'd like our assistance on the ground here in Mali. So at IGMH, we ran the neurosurgical service, the medical gastro service, and we also sent a team of anesthetists to help with the shortages of staffing initially during the relationship. Going forward, obviously, apart from tying up with Asanda and apart from treating several patients from Maldives year on year back in Chennai, these are patients that couldn't be treated in Maldives. We also had certain training programs for the doctors from Maldives who were in the government service, certain specific programs for specific skills that they required. Also on the administration side, because there are areas like human resource, etc., where some training was required. So in a lot of areas we've collaborated with Maldives, and we realized that there are wins both back home for us in India and of course here in the Maldives. Rehabilitation has been around for a long time in healthcare. The importance of rehabilitation has recently come to the fore, especially in developed countries following COVID. As you know, even if you get treatment for COVID, even if you have a vaccine for COVID, or if you're admitted in hospital for COVID, significant number of patients are unable to get back to normal life or work without specific pulmonary rehab. And around 4 years ago, we realized this and started the rehab center in MIOT. And this has been rolled out to other specialties as well. So whether it's a person who's a child, or whether it's an adult, whether it's a condition that they were born with or a condition that developed as they grew older, whether it's an injury that happened, an accident at work, at home, or on the street, like a road traffic accident, or a treatment that needs rehab, a surgery to a particular area that has resulted in only 50% of improvement and the remaining 50% satisfaction and improvement given to the patient by rehab. So this is how we realized that rehab was so incredibly important for the success of treatments, for the satisfaction of treatments, and to get patients to the exact area that they wanted to be, the sort of activities that they wanted to be able to do. Without rehab, just by having a certain surgery or certain procedure, they wouldn't have achieved it. I think that we see a lot of patients getting excellent treatment in Maldives itself. There are patients in Maldives suffering from a whole spectrum of disorders, from neuro disorders to sports injuries that are treated extremely well here, spine surgeries done very, very well here, joint replacements, but not feeling the kind of satisfaction they want to feel, not getting back to the sort of activity they feel they want to be able to do. We've also seen that in India as well. As I said, we have certain synergies between India and Maldives, and we've seen how in India that is achieved very, very easily. The rehab has a very low cost. It's also approved by Asanda, and it's very easy because some of the specific skills required for rehab are available here in the Maldives as well. Well, I think that a lot of entities in developing countries, entities in healthcare, don't attach any importance to rehab. For them, rehab is just physiotherapy. So suppose you go for a procedure, most of the time it's an orthopedic or neuro procedure, you have some kind of physio. And that's it. And it lasts, and it's just a physio done under instruction of the treating physician. It's not done by a complete assessment. It's not done with dialogue with the patient as to where they want to get. So this is the reason why a lot of developing countries do not have a comprehensive rehab center. In India itself, the rehab center at MIOT is the only rehab center in the whole of South India. So we thought, seeing that we're treating so many Maldivians, that a lot of Maldivians could have all their care in their own country if we opened a rehab center in Maldives. The easiest to understand would be a patient with a stroke. So patients with a stroke either have weakness in both their legs, have problems with walking, have problems with swallowing, have problems with feeding themselves, have problems with being independent. So the biggest and easiest to understand beneficiary is a stroke patient. But apart from that as well, we have very broad spectrum ranging from children who are born with disabilities, who are born with special needs, right up to old people with neurological diseases like Parkinson's disease, people who have problems with their walking style, people who have problems with balance. What I mean by that is people who are afraid they're going to fall, or people who are having frequent falls. All these people can benefit from rehab. Today, there's a huge problem with cost. In the past, people could stay in hospital after a simple treatment for 2 weeks, 3 weeks, no problem. But now, that is a huge issue to all governments in the world, the cost of keeping a patient in the hospital. Second, what happens when you go home? In the past, you went home, there were joint families, especially in India. You had 6, 7 people at home to look after you. That's not there now. So without proper rehabilitation, you won't gain independence. Without proper rehabilitation, you won't gain the sort of unrestricted activity, ease of activity that you were used to. And if you want quality of life, you won't achieve quality of life without rehabilitation. So rehab is disease specific and is not one individual. The assessment for rehab has to be done by a specialist who's qualified in rehabilitation medicine with a separate degree you study, but this specialist draws upon the skills of various others. For you to get back to a specific job you're doing, you'll need an occupational therapist. If you have a problem with a certain kind of expressive disorder, suppose you've had a stroke, then you need a speech therapist. If you've had a problem because of a certain treatment to your throat, a certain kind of cancer, somebody will have to teach you how to swallow, how to eat, how to make sure that food goes into your body without causing a problem with your breathing, which is called aspiration. So for that, you'll need a speech and language therapist. Then you have the various other specific therapists who will work on balance, who work on understanding, which is called comprehension, cognitive areas. So you will have also other people from the mental aspect side of well-being who will be coordinating in your healthcare. So depending on the sort of disease you've got and come to us for rehab, you may need a team of 13, 14 people who will be involved in preparing a rehabilitation program for you. This team is called the Rehabilitation Board. Once they prepare that program for you, then you will know whether it's going to take you 3 weeks, 6 weeks, or a month or 2 for you to achieve the goals that you want to achieve via rehab. MIOT Hospitals Chennai is one of the few hospitals in the world where nobody is part-time. Every single one of the 3,000 employees is full-time. When you have full-time employees, like we have here in Malé at the rehab unit, they work as a team. This team will meet and discuss cases 2 or 3 times a week and is referred to as the rehab board. So it is not an individual who is going to treat you or who is going to make your plan. It's a collection of specialists. These specialists are highly competent at dealing with a certain aspect of rehab, and they will come together to form your program. One of the most spectacular equipments is the gravity removing equipment for patients who are paraplegic, who have no power in their lower limb or very little power in their lower limb and who need to learn how to walk. So this is a harness that suspends the patient, eliminating gravity. And then the patient first learns to walk on a motorized walking path and then slowly graduates to walk on a normal ground. The other is the equipment that deals with equilibrium. A lot of us who have had a problem because we are bedridden are unable to sit or stand because suddenly our blood pressure will drop. So this special tilt table is something where you will lie on it flat and then slowly at incremental angles you will be taught and your body will get used to being in the upright position, and then you will not have problems like dizziness or fainting or falling down, because from a bedridden status you're being slowly graduated to sitting, standing and walking. So these are two of the spectacular devices amongst others that are here. Well, the center is a very broad center which treats such a varied degree of patients. So apart from the elevator, which has entry for disabled patients in their wheelchair, etc., to the specially designed disabled toilets, a lot of aids exist in the planning itself and have been executed to ensure that the very physically challenged patient is not only looked after well but is also safe. As you correctly mentioned, rehab is a team sport. So a big team needs to ensure that there's all-round input to get the patient to their particular stage of recovery, what the patient calls his end point or destination. Sometimes you may need a specialist for a very specific reason, and we have already committed to not sending the patient to another geography. Therefore, with sophisticated telemedicine devices where information can be shared, the patient can be examined, parts of the patient can be specifically looked at. For example, if there's a swallowing issue, there's a special camera that can show the areas of the patient's throat, or if there's a skin issue, specific areas can be examined. And in real time, our specialists in 63 different specialties sitting in Chennai can perform a consult with the patient sitting here in Malé, the capital, without traveling outside the Maldives, and give a specific, highly specialized opinion, which will have a huge impact on the care of the patient. Right, so to be very frank with you, over the last 2.5 years, there are over 3,000 success stories. But we've had some amazing success stories from patients here in Maldives, children who come to us with cerebral palsy, whose walking pattern is grossly improved, children who come to us at certain spectrum of autism, whose communication and cognition has grossly improved, and of course adults, some who come to us after spine surgery with a certain amount of weakness of the muscle and paralysis, who we've got back their confidence to walk and to get back to daily activity. Also, middle-aged adults who've been bedridden for some time because of specific diseases of their joints, who we've rehabilitated so that they can be integrated back to their family and in fact gone back to looking after their children independently. So these are some of the specific success stories out of the over 3,000 that happened in the last couple of years that I can share with you.